There is a real reason why we do everything we do at eConsult. We were born within the NHS. Our team, as well as being brilliant technologists, also has many, many clinicians within it. And that goes right through the whole team. And with that in mind, patient safety is at the heart of everything we do. So the key bit of the journey that patients start on is the front door, where they come in via your practice website or through the NHS app and submit an eConsult request. And the patient answers a mix of both structured questions and free text boxes. But that's really, really key, because we're not just sticking a couple of free text boxes on a website. We've got tens of thousands of questions behind the scenes. And there's a real reason why we ask a structured history up front. We ask of structured history because we're trying to arm the clinician with enough information to close the case or triage that patient and know what to do next. And we know that if you just stick a couple of free text boxes up there, actually invariably the clinician will have to ring that patient back and gather more information. So there's a clear reason why we ask a structured history up front. And we're now getting hundreds and thousands of patients coming through to your practices every day. And I suspect in January, we'll do 1 million consults coming through the system this month. Now, as you know, the practice receives the consults into their workflow of a day. And actually now we can push these consults directly into the clinical system. So we can push them into System 1, we can push them into EMIS. If you're not making use of that, please get in touch with the team. Very soon, we've got direct pushing into Vision coming too, although slight caveat that's only for England and Wales, because Scotland are on their own very special version of Vision, but we're working on that. The GP practice then reviews the eConsult, and based on that information, because we've captured a really rich history up front, you can use that information, you've got the clinical record, and you can then triage that case and respond to the urgent ones urgently, or push the less urgent ones into the most appropriate place to them to be dealt with. And the report that we produce for you is a really kind of clear representation of the questions, that history, any photos that have been taken. And once you've got that in front of the right staff member, we know that you can then close down 90% in some cases those consults remotely. And the reason we can do that is we're giving you enough information to make a decision. And that case you'll close down either with a message back to the patient, and we've got some enhancements coming to the post-consult messaging, which we're going to share with you later. You can push really rich content back to the patient so that you can give some advice. You can follow them up either with a phone call or with a video call. And actually then you only need to bring in to be seen face-to-face those patients that really need to be seen face-to-face. And the final point I'll make here is the red flag. So underlying this is that whole strand I talked about of patient safety. So this system is really safe, and actually you can be assured that the patient submitting an eConsult on a Friday, if it's safe enough to wait for you to see that on Monday, it's safe enough to wait for you to see it on Monday. That's really important. And that's due to the significant amount of red flags that we've got behind the scenes, making sure that this is a safe system. And if you think about a simple free text box system, that doesn't have any red flagging at all. And why is that important? Well, this is just one example. And I'm sure each of you as practices and clinicians will have examples of care that's been actually enhanced by the use of an online consultation platform. This is just one example. I'm not going to read it out to you, but it was a patient who'd attended the GP on various occasions with bleeding, and actually, because with the eConsult, we took a really structured history up front. We managed to use that, the GP, that with the clinical system, within 24 hours, had picked up that this was a potential cancer and done a 2-week wait. Now, that's exactly the sort of case that might have waited in the old world a few weeks potentially to be seen by the GP in the first place, whereas actually this was picked up within 24 hours, 2-week wait referral made, and that pathway was really seamless straight through to the specialist. So, final slide from me. This is just to say that actually eConsult encompasses that whole journey from the patient submitting the information, taking a really rich, robust history, pushing that through to the clinician, then having the ability to action that consult with a messaging, with initiating great video, pushing really rich content back to the patient, and that's all included within the bundle of eConsult. Very soon, we're going to be rolling out to everyone a toolbar which will put all this useful kit in one place for you, right on the screen. So I'm going to